Tourette's syndrome is a neurological disorder characterized by repetitive, involuntary movements and vocalizations called tics. Tics can range from mild to severe, and while the exact cause of Tourette's is not fully understood, it is believed to involve a combination of genetic and environmental factors affecting brain areas related to movement and behavior control. Symptoms: the main symptom of Tourette's syndrome is tics, which can be divided into two categories. Motor tics, involuntary movements that often involve the face, arms, or body. Common motor tics include eye blinking or rolling, head jerking, shoulder shrugging, facial grimacing. Vocal tics, involuntary sounds or words that can vary in intensity and type. Common vocal tics include throat clearing, sniffing or grunting. Humming in rare cases. Complex vocal tics such as echolalia, repeating others' words, or coprolalia, involuntary swearing or inappropriate words. Tics can be simple, brief and repetitive movements or sounds, or complex, a combination of movements or vocalizations. They tend to fluctuate in severity and frequency and may worsen with stress, excitement, or fatigue. Most people with Tourette's experience the onset of symptoms in childhood, usually between the ages of 5 and 10. Causes and risk factors: the exact cause of Tourette's syndrome is unknown, but research suggests several contributing factors. Genetics: Tourette's syndrome often runs in families, indicating a genetic component. However, specific genes associated with the disorder are not yet identified. Brain chemistry: neurotransmitters like dopamine and serotonin, which play roles in controlling movement and mood, may function abnormally in people with Tourette's. Environmental factors: infections, prenatal or perinatal factors, and other environmental factors may increase the risk, although they are not proven causes. Diagnosis: Tourette's syndrome is diagnosed based on clinical observation and medical history. There is no specific test for it, but healthcare provider will look for the presence of both motor and vocal tics that have persisted for more than a year. Onset before the age of 18. Symptoms that are not due to other medical conditions or medication. The diagnosis is often made by a neurologist or psychiatrist, and additional evaluations, like blood tests or imaging scans, may be used to rule out other conditions. Treatment and management: while there is no cure for Tourette's, various treatments can help manage symptoms, especially if they interfere with daily life. Behavioral therapy. CBIT, Comprehensive Behavioral Intervention for Tics, a form of behavioral therapy that teaches techniques to manage tics and reduce their frequency. Habit reversal therapy helps individuals become aware of the urge to tic and teaches them competing responses. Medications. Dopamine blockers. Medications like haloperidol and pimozide can help reduce tic severity, although they may have side effects. Alpha-adrenergic agonists. Drugs like clonidine and guanfacine, commonly used for high blood pressure, can also help reduce tics and are often used in children. Antidepressants, sometimes prescribed if the individual also has anxiety or obsessive-compulsive symptoms. Supportive therapies. Educational support. Many children with Tourette's benefit from individualized educational plans and accommodations in school settings. Counseling. Therapy can help with the social and emotional challenges associated with Tourette's. Family support and education. Families can benefit from understanding the condition and learning coping strategies to support their loved ones. Deep brain stimulation (DBS). For very severe cases that don't respond to other treatments, DBS may be considered. This involves implanting a device that sends electrical impulses to specific areas of the brain, though it is still considered experimental for Tourette's. Co-occurrent conditions. Many individuals with Tourette's syndrome experience other conditions, such as attention deficit/hyperactivity disorder (ADHD), obsessive-compulsive disorder (OCD), anxiety and depression. Learning difficulties. Managing these co-occurrent conditions is essential to improving overall quality of life for individuals with Tourette's. Coping strategies. Living with Tourette's can present unique social and emotional challenges, so developing coping strategies is important. Education and awareness. Learning about Tourette's and educating others can reduce misunderstandings and stigma. Stress management. Practicing relaxation techniques such as deep breathing, mindfulness, and physical activity can help reduce stress and, in turn, may reduce tic frequency. Social support. Connecting with others through support groups can help individuals and families feel supported and less isolated. Prognosis. For many, the frequency and severity of tics may decrease with age, especially during adolescence. Some individuals experience significant improvement or even remission of symptoms in adulthood, although tics can also persist. Conclusion. Tourette's syndrome is a complex neurological disorder with varied presentations and levels of severity. While tics are the primary symptom, supportive treatment and a strong network of family, healthcare providers, and educators can make a positive impact. Early diagnosis and appropriate interventions help people with Tourette's lead full, productive lives.